You can survive a heart attack if you do this in 10 seconds. Have you ever been afraid to go to sleep? Not because of nightmares, not because of insomnia, but because of the quiet fear that you might never wake up again in the morning. I once had a patient who said to me, "Doctor, every time I lay my head on the pillow, I ask myself, if my heart stops beating tonight, will anyone even know?" That was not a complaint. It was not self-pity. It was the silent truth that millions of older adults who live alone face every single night. You may think you'll know when a heart attack is coming, that you'll feel a sharp, unmistakable pain in your chest and still have enough time to call someone for help. I'm sorry to tell you, but that only happens in the movies. In reality, it is quieter, vaguer, and far more terrifying. It can strike while you're reading the newspaper, while you're pouring yourself a cup of tea, while you're just about to walk out the door. No noise, no warning. And the most dangerous part? You may have only 10 seconds to decide between life and death. Sounds dramatic, doesn't it? Maybe. But listen to me carefully. If you have a heart attack and no one is with you, the risk of dying can be as high as 89%. But if you know exactly what to do in those first 10 seconds, your chance of survival can soar to 92%. Not with pills, not with machines, just by taking the right action in the decisive moment. My name is Dr. Esteban Ramirez. I am 83 years old. I have spent nearly half a century in cardiology. I have seen hearts stop beating right before my eyes, and I have seen hearts keep going, even when everyone thought hope was gone. And the difference, more often than not, had less to do with disease and more to do with preparation. Let me tell you the story of Jose Mendoza, 78 years old, living alone. One early morning, he felt a heaviness in his chest, without knowing why. His left arm began to tingle. An unusual fatigue rose over him. At that moment, he did not wait. He did not guess. He did not panic. He acted. And because of that, he is still alive today to tell me the story himself. Do you want to know what he did? Not out of curiosity, but because one day, if you find yourself in the same situation, you will not have time to think. You will only have time to remember and act. In the next part, I will take you into that very morning, step by step, as Jose carried out 8 actions, each one small, each one precise, and why those simple steps were powerful enough to keep him conscious long enough for the ambulance to arrive. So I ask you, are you ready to learn? Or are you still telling yourself, that will never happen to me? I hope you'll stay with me long enough to find out, because what you are about to learn may one day save your own life.
I was alone, but I was prepared. That morning, Jose Mendoza woke up as he always did. The air was still cool with early dawn mist. He got out of bed, made himself a cup of coffee, and opened the newspaper. It was a morning just like thousands of others in his 78 years of life, until he felt that something wasn't right. It wasn't sharp pain. It wasn't dizziness. It was a strange, unsettling sensation in his chest, as if an invisible hand were squeezing his heart, not strong enough to make him collapse, but strong enough to make him stop. Have you ever felt that something was not the same as usual, but you couldn't quite put a name to it? A touch of fatigue, a faint numbness in your left hand, a vague, unexplained pressure in your chest. That was exactly what Jose felt. And at first, like so many of us, he thought, maybe it's just because I ate too much last night. Probably just indigestion. I'll be fine. But 15 minutes passed. The feeling did not go away. It grew clearer, tighter. A light, stabbing sensation moved from his chest to his left shoulder, then crept into his jaw.
It wasn't excruciating, but it was undeniable. And in that moment, he knew. This is a heart attack. He didn't need anyone to confirm it. He didn't need a heart monitor. He didn't need to search Google. He had learned how to recognize it. And more importantly, he had learned how to respond. He did not hesitate. He did not reach for antacids. He did not try to walk it off. He did not call his son in the middle of the night hoping someone could rush to him in time. He did exactly what I had once told him. If you feel these 3 signs, chest heaviness, arm tingling, and unexplained fatigue, don't guess. Act. So what did he do? First, he sat down on the chair nearest the front door, his back resting firmly against it. He had practiced sitting at a 45-degree angle every evening while rehearsing the 8 steps. That position helped stabilize circulation and reduced the risk of sudden fainting. Then, he reached into the kitchen drawer, where he kept a strip of 100 milligrams aspirin and chewed 1 tablet. Not swallowed whole, but chewed, exactly as he had practiced. Do you know why chewing aspirin matters so much? Because it allows the medicine to absorb into the bloodstream quickly, within minutes, helping to break up the clot that might be blocking his coronary artery. And for a 78-year-old man with a history of high blood pressure, time was the one thing he could not afford to waste. Next, he called emergency services, but instead of just saying, "I'm having a heart attack," he spoke clearly, giving his exact address, the building name, the door code, the apartment number. Because he knew in a heart attack, you can lose consciousness at any moment. And if you pass out before giving rescuers the details, they may never find you in time. After making the call, Jose unlocked his front door, slipped the key into his shoe, and taped the electronic entry code right next to the handle. That is the detail so many of us forget. You may call for help, but if the rescuers can't get inside, everything else becomes meaningless. And while he waited, he did not scream. He did not panic. He did not beg for help in desperation. He breathed. Inhale for 4 seconds. Exhale for 6 seconds. Repeat. And when his heartbeat began to race erratically, he pressed his thumb firmly against his wrist pulse and coughed 3 strong times, a circulation support technique I had taught him months earlier during a health consultation. Can you picture it? An almost 80-year-old man sitting alone in his living room, calm, precise, carrying out each step as though reading aloud from a survival manual etched in his memory. No fear, no confusion, only preparation. And the miracle was this. When the ambulance arrived 14 minutes later, he was still conscious, sitting in the correct position, alert enough to answer every question from the medical team. Later, the paramedics told me, "We've never seen anyone his age remain that stable during a heart attack." After 4 days in the hospital, he was discharged. Within 2 weeks, he was walking normally again. And today, he is still alive, still drinking his morning coffee, still telling his grandchildren about that fateful morning. What do you think saved him? The doctor? The ambulance? Pure luck? I don't believe so. I believe it was preparation. It was the fact that he had once heard me say, "Don't wait until the heart attack strikes to learn how to survive. Practice now, as if tomorrow it will happen." And he had practiced. He had trusted. He had been ready. And what about you? Have you ever thought about what it would be like to find yourself in that same situation? Do you know the 5 earliest warning signs that can reveal a heart attack before it's too late?
And if one morning you feel that strange sensation that something isn't right, will you know what to do? If you're not completely sure, then the next part is absolutely critical for you. Because what I'm about to share are the 5 first signals, your body's urgent whispers. But only if you recognize them in time will you have the chance to act. Are you ready to hear those 5 warning signs? Then don't leave this video because we're about to begin right now.
5 warning signs of a heart attack. Don't let your body scream in silence. If you were waiting for a dramatic stabbing pain like in the movies, I'm sorry, you may already miss the only chance you have to save yourself. The heart doesn't always shout with a scream. More often, it whispers. And the real problem is, most people never hear that whisper. Your body is always trying to warn you, but it speaks in a language that very few people ever take the time to learn. The language of the unusual, of the sensation that feels different from every other day. Have you ever felt something strange that you couldn't quite name? Listen carefully, because if you feel 2 out of these 5 signs, you must act immediately. And if you notice even one sign, but you also live with underlying conditions like high blood pressure, diabetes, or elevated cholesterol, then even that single sign is enough to trigger a full red alert. The first sign, pressure, heaviness, or the sensation of squeezing right in the center of your chest. Not a sharp stabbing pain, not a burning ache, but more like a heavy stone placed squarely on your chest that simply refuses to move. Have you ever felt unable to take a deep breath, even though you were not doing anything strenuous? One of my patients once described it this way: "Doctor, it feels like an invisible hand is squeezing my heart from the inside out." If that feeling lasts longer than 15 minutes and it does not go away with rest or with antacid medication, you must not wait. Do not think maybe it will pass in a while. Remember Jose. His story began with this very same sensation. The second sign, pain that radiates beyond the chest. It usually starts in the chest, then spreads into the left arm, but sometimes it travels upward into the neck, the jaw, or the upper back. In women, pain in the jaw is especially common, often mistaken for sinus trouble or a dental problem. Have you ever felt an ache that spreads, moving across several areas of your body with no clear starting point? If pain travels in this way, don't dismiss it, and don't wait until it becomes intense. A heart attack does not need to be severe to be dangerous. It only needs your neglect, and if you ignore it, it will win. The third sign, a sudden overwhelming fatigue even when you've done nothing at all. I don't mean the tiredness that comes after walking or cleaning the house. I mean the kind of exhaustion that makes you sit down and not want to get back up again. The kind of fatigue that makes you feel as if your body no longer wants to cooperate. Women over 65 experience this symptom very often, and very often dismiss it. Have you ever thought it's just old age? But if this unusual fatigue comes together with tingling, dull aching, or a sense of heaviness in the chest, then it is not simply aging. It may be your heart's very first warning cry. The fourth sign, sudden shortness of breath with cold sweating. Imagine this. You are resting, sitting in front of the TV, when suddenly you feel as though you cannot catch your breath. You inhale, but it is never enough. And then, out of nowhere, a cold sweat breaks out, even though the room is not hot. Many people mistake this for anxiety or a panic attack. But if it comes together with heaviness in the chest or pain that radiates outward, this is not the time to sit and wait. This is the time to sit down properly and begin your survival response. Do you know why cold sweat is such a frightening sign? Because it means your sympathetic nervous system is firing off a desperate alarm in reaction to a hidden internal crisis. A crisis you cannot see, but one that your body is fighting against.
second by second.
And finally, the fifth sign, sudden dizziness, nausea, or vomiting. You might feel perfectly fine, and then suddenly the world spins, your head grows light, as if you are losing balance. You feel nauseated even though you have not eaten anything unusual. In that moment, many people reach for stomach medicine, but do you know what a fatal mistake that can be? Because often, the stomach is not to blame at all. It is the heart crying out in distress, sending its alarm through the neighboring systems. A 72-year-old woman once told me, "I only felt lightheaded and a little nauseous. I took a digestive pill and laid down. When I woke up, I was in the ICU." Does that sound familiar? Have you ever experienced one or more of these sensations and brushed them aside, thinking, "It's probably nothing"? You are not alone. In one study published on PubMed, up to 87% of people who had a heart attack mistook their early symptoms for something else, digestion problems, stress, or even a simple flu. And while they were waiting for the discomfort to pass on its own, their heart was being damaged minute by minute. But you don't have to become one of those 87%, because today you know. And once you know, you realize these strange feelings are not random at all. They are signals, they are early warnings, and they are your last chance. The question is, if you feel even one of these 5 warning signs, what will you do? Will you wait another 15 minutes? Will you reach for antacids? Or will you act?
The next part will be the most important part of this video. I will guide you through 8 specific steps, one by one, that you must take the very moment you suspect you are having a heart attack. And I will not use medical jargon. I will speak to you as if you were sitting right here in front of me, just as I once spoke to Jose. Because if you can remember these steps, you won't just survive, you will live calmly, with control, and with hope. Are you ready to memorize these 8 steps? 8 steps to survive a heart attack when you are completely alone. You don't need a doctor by your side. You just need to remember this.
Step 1. Immediately stop whatever you are doing and sit down in the safest place you can. Do not try to stand. Do not walk around. Do not think, "I'll just finish this one thing before I rest." If you are in the kitchen, find a chair. If you are in the hallway, sit right down on the floor with your back against the wall. Why? Because if you tried to keep moving, you could collapse at any moment. And if you hit your head on the way down, the situation becomes far worse. Have you ever thought that simply sitting could save your life? But that is exactly how Jose began, and because of that, he did not lose consciousness, and he avoided further injury.
Step 2. If you have aspirin, chew 1 tablet of 100 milligrams immediately. Do not swallow it whole. Chew it thoroughly. Aspirin helps slow the blood clotting process. It can help break apart the clot that may be blocking your coronary artery. But only if you chew it, not swallow it whole. Chewing allows the medicine to reach your bloodstream much faster. Do you keep aspirin in a visible, accessible place? On top of the refrigerator? In the medicine box next to your bed? If not, today, after watching this video, do it. Don't wait until the heart attack strikes to start searching. And if you are allergic to aspirin or already on prescribed blood thinners, skip this step and move directly to the next one.
Step 3. Call emergency services and give your address in the very first sentence. Many people dial 911 and start describing their symptoms. "I have pain, I can't breathe, I don't feel well." But what if you pass out halfway through that call before you ever give your address? What happens then? No one knows where you are. That's why when you place the call, your very first words should be your name and your exact location. "My name is Linda Evans. I am at 345 Pinewood Street, apartment 2B. I believe I am having a heart attack." Do you know your address by heart? Do you have it written down somewhere to read quickly in a panic? If not, write it on a piece of paper and tape it next to your landline phone or by your bedside. That's not being overly cautious, it's protecting your life.
Step 4. Unlock the door and leave the key or entry code in a visible place. Have you ever thought about what happens if the ambulance arrives but can't get inside your home? If the door is locked, they may have to break it down, and those few minutes spent forcing a door could be the very minutes you no longer remain conscious. If you live alone, you must have an emergency entry plan. Keep a spare key under a mat, inside a flower pot, or tape the electronic lock code right next to the handle. You may think, what if someone steals it? But if your heart stops beating, the last thing you will care about is the lock.
Step 5. Sit at a 45-degree angle with your legs slightly elevated. This is the heart protection posture that very few people know. Lean back, not flat on your back, and raise your legs on a pillow. Why? Because lying flat can cause fluid to build up in the lungs. Sitting fully upright forces your heart to work harder. But at a 45-degree angle, blood flow to your brain and heart is maximized without creating extra strain. Do you have a reclining chair in your home? A soft sofa? Make that your designated emergency seat. Step 6. Send a short text message to loved ones. Do not make phone calls. At this moment, speaking drains your strength. You need oxygen, you need focus. Instead of calling, send a short text. I suspect I am having a heart attack. I called 911, waiting for the ambulance. Send it to 2 or 3 people, not just one. Because what if that person is asleep or misses the message? You might think this is overreacting, but if it were your mother or your spouse, wouldn't you want them to message more than one person? Step 7. Breathe deeply. 4 seconds in, 6 seconds out. This is a technique to control your nervous system. When you breathe deeply and slowly, your heart rate doesn't skyrocket. Your body conserves oxygen and reduces the burden on your heart. Inhale through your nose for 4 seconds. Exhale through your mouth for 6 seconds. Repeat. Count in your head. Imagine blowing out candles. Each breath is a message to your heart. Stay calm. I am still in control. Have you ever practiced paced breathing? If not, don't wait until an emergency. Make it part of your nightly routine so that when the time comes, you're ready. Step 8. Press firmly on your wrist and cough 3 times in a row. This is a supplemental step, not a substitute for medical care, but it can help maintain circulation for a short time. Use your thumb to press firmly against the inside of your wrist, right where you feel your pulse. Then cough hard 3 times. Each cough pushes blood out of your heart, helping maintain rhythm. This technique has been used in certain sudden cardiac events. Do not overuse it. Do not repeat endlessly. But if you feel yourself about to lose consciousness, try it. It might buy you a few extra minutes, just enough for emergency care to arrive. Jose, the man whose story I shared with you, followed all 8 steps. He was not smarter than anyone else. He didn't have special equipment. He had only one thing: preparation. And because of that, when the paramedics arrived, they found him still conscious, still breathing steadily, still sitting in the protective position, and with his door already unlocked. He was taken to the hospital within 15 minutes, and today he is alive and well. Do you want to be like Jose? Or do you want to leave your future up to chance? I know which choice you would make. And in this next part, I will show you something important. If you never want to be in a position where you must use those 8 survival steps, there are 3 simple things you can begin today. I call them the 3 golden habits. They don't just lower your risk of heart attack. They help you live longer, healthier, and sleep more peacefully.
Do you want to know what these 3 habits are?
The 3 golden habits. You don't have to be a doctor. You just have to start today. I know there is something many of you secretly hope for: to never have to face a heart attack at all, to never chew an aspirin in the middle of the night, to never panic looking for your phone, to never have to unlock the front door for the paramedics at 2 a.m. And let me be honest with you, that hope is possible. In over 40 years as a cardiologist, I have met thousands of people who lived well into their 80s without ever experiencing a heart attack. They didn't have special genes, they weren't taking miracle drugs, but they all had one thing in common: 3 very simple habits that anyone can adopt. Yes, even you. Even if you are 75, even if you once smoked, even if you're on blood pressure medication right now. Are you ready to listen and to begin today? Golden habit number 1. Walk for 30 minutes every day. You don't need to run. You don't need to climb hills. Just walk gently, consistently, every single day. You can walk around your house, through the park, inside a shopping mall. The important thing is not speed, it's regularity. Why? Because every step you take improves blood circulation, lowers blood pressure, stabilizes blood sugar, and prevents plaque from building up inside your coronary arteries. A study from Harvard showed that seniors who walked at least 150 minutes per week reduced their risk of heart disease by 31% compared to those who were sedentary. You might think, I'm too old. What's the point of walking now? But Ernesto, age 82, walks every morning at Santa Lucia Park. He walks when it's cold, he walks when it's hot. And every time I see him at his regular checkups, I am astonished. His heart is as strong as someone in their 60s. Can you do the same? Just 15 minutes in the morning, 15 minutes in the evening. A good pair of shoes and one promise to yourself. I walk so I don't have to walk into the hospital. Golden habit number 2. Cut back on salt as much as possible. It may sound small, but salt is the silent killer in your kitchen. It doesn't just raise blood pressure, it damages your arteries, increases your risk of heart failure, stroke, and even kidney disease. Did you know the average American consumes twice the recommended daily amount of salt? And not because you sprinkle too much on your food, but because most of it hides in processed products. Deli meats, bread, canned soups, instant noodles, sauces, frozen meals. Rosario, 79, once told me, "At first, food tasted bland, but after a month, I couldn't stand salty foods anymore. They gave me headaches and made me uncomfortable." And the result? Her blood pressure stabilized. Her medications were reduced, and she finally began sleeping soundly again. Are you eating too much salt? You can begin with something simple today. Maybe it means skipping the extra soy sauce. Maybe it means reading food labels before you buy. Maybe it means using natural seasonings like garlic, lemon, or fresh herbs instead of seasoning powders. Every small step is one step farther away from a heart attack. Golden habit number 3, quit smoking and drinking no matter how old you are. I've heard hundreds of patients say, "Doctor, I've smoked for 40 years. There's no way I can quit now." But the one I remember most was Carlos, age 74. He quit smoking at 70 after watching his son land in the hospital with a heart attack. 6 months later, he came back to see me and said, "Now I can breathe deeper, I sleep better, and I climb stairs without stopping." Do you know something? Within 24 hours of quitting, your risk of heart attack begins to drop. After 1 year, it is cut in half. Your body is always grateful. It is always ready to heal if you give it the chance. Alcohol is the same. No one is saying you must give it up entirely, but every drink less is one less burden on your heart. And if you are on blood pressure medication, diabetes medication, or cholesterol-lowering drugs, alcohol can interfere with your treatment or magnify side effects. And here's the miracle. Combining all 3 habits, walking, reducing salt and quitting tobacco can reduce your risk of heart attack by more than 70%. That is not a commercial. That is the conclusion of a 15-year study following more than 44,000 older adults published in the journal Circulation.
So now I want you to ask yourself, which one of these three can I start today? Not all at once, just one small change done consistently. Because heart health doesn't come from dramatic decisions. It comes from thousands of little choices made every single day. You don't need a doctor by your side 24/7. You don't need a miracle surgery. You need willpower, the right information, and one first action. And you already have all of that today in this very video. Do you remember the feeling I described in the very beginning? The fear of laying your head down at night, unsure if you will wake in the morning. The worry that no one would know if your heart stopped beating in the dark. The loneliness of feeling pain in your chest with no one there to help. But now, do you see? You are no longer powerless. Because now you know the 5 warning signals your body gives earlier than you ever realized. You have learned the 8 critical steps, small actions powerful enough to turn the tide in your favor. And you have heard the 3 simple habits that may prevent you from ever needing those emergency steps at all. Today, you are different. Today, you know. And knowledge is power. Not the loud kind of power, but the quiet, steady kind. The power that kept Jose sitting calmly, breathing deeply, and staying alive. I want you to write this down, handwritten if possible. Post it on your refrigerator, next to your bed, somewhere you will see it every single day. I am prepared. If a heart attack comes, I will not give up. I know what to do, and I will survive. This is not just a sentence, it is a promise you make to yourself and to the people who love you. And if you found this video helpful, please don't keep it to yourself. Share it with your elderly friend. Share it with your sister living with diabetes. Share it with your neighbor who lives alone. Because tomorrow, it may be them or you who needs this knowledge to survive. And if you truly want to mark this day as a turning point, leave a comment with 4 simple words. I am prepared. I will read every comment because those are not just letters on a screen. They are heartbeats, lives, choosing awareness, choosing readiness, choosing life. And I know, from this day forward, you are no longer the same person. My name is Dr. Esteban Ramirez. I am 83 years old, and today I am not only speaking to you as a doctor, but as someone who has witnessed many hearts stop beating and many others keep going because of preparation. Take care of yourself. Live many more years with health, with joy, and with peace. And I will see you in the next video.